Let's talk about Medicare, the good, the bad, and the ugly. Today we'll be talking about the dark side of Medicare. Make sure to check out some of our other videos to learn more about Medicare in general. Of course, you can always reach us in the comments below or at the number on the screen, and there is no charge for our services. And of course, please make sure to like this video and subscribe to stay up to date. What is a deductible? A deductible is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. For original Medicare, there are actually two deductibles, one for Part A and one for Part B. So the Part B deductible is actually not that big of a deal. It's a once annual deductible, and once you've met it, you'll be responsible for a copay or coinsurance. Usually that's pretty low. And in 2024, that deductible is $240. The problem is the Part A deductible, and that is applied per benefit period. So the Part A deductible in 2024 is $1,632. Now the reason that this can be problematic is that it is not applied annually, but rather per benefit period. So if you hover over here, this little pop-up will appear. And this is regarding the benefit period. So it says here a benefit period begins the day you're admitted as an inpatient, which is in a hospital, or SNF, which is a skilled nursing facility. That is not the same as like a nursing home that you might think of for long-term care. Skilled nursing facility is really for habilitative or rehabilitative services after you've been hospitalized. And the benefit period ends when you haven't gotten any inpatient hospital care or up to 100 days of skilled nursing facility care for 60 days in a row. So basically, think of it, you're admitted into a hospital, you have whatever procedure needs to be done, you either go to a skilled nursing facility or you go home to recuperate, and as long as you are not readmitted within 60 days, well, after that 60-day mark, basically a new benefit period would apply. So let's say you needed to have knee surgery and you are admitted into the hospital, you have your surgery, let's say you go home to recuperate, 60 days passes because there are no complications, all is wonderful, and then later in the year, maybe just a month later, you have severe heart complications and you need to be admitted to the hospital again. You would have to once again meet that deductible because it is not annual, it is per benefit period. So if you become very ill, you may need to meet that deductible multiple times in a given year. Speaking of costs, let's talk about the out-of-pocket maximum, or rather the fact that there is no out-of-pocket maximum with original Medicare. An out-of-pocket maximum is there to protect you from major medical bills. So, should you incur major medical expenses and you reach that financial threshold, which is the out-of-pocket maximum, your insurance carrier would take on the remainder of the medical bills for that calendar year. Now, this is not the case with original Medicare. Because there is no out-of-pocket maximum, there is no financial threshold. That means if you have major medical needs and therefore major medical bills, there's really no limit on what your expenses could be. And original Medicare alone can basically have a cutoff of how long you can be hospitalized. Let's talk about those lifetime reserves. So to understand how your lifetime reserve days work with original Medicare, specifically Part A, you really have to understand how the coinsurance works. So as I said, first you have to meet that deductible, which is $1,632, and that is again per benefit period. But then once you have met that deductible, there's actually no coinsurance for days 1 through 60 when you're hospitalized. Now, if you do need to be hospitalized longer than that, or if you are released and then readmitted during the same benefit period, then once you reach days 61 to 90, it is $408 per day. And after 90 days, it is $816 per day. However, you may only be hospitalized during that benefit period for an additional 60 days. Those are your lifetime reserve days. And as the name indicates, this is once in a lifetime. Now let's talk about late enrollment penalties, specifically the Part B late enrollment penalty. Now, if you are subject to the Part B late enrollment penalty because you are delinquent in signing up, then you would be responsible for an additional 10% of the base beneficiary premium for each 12-month period that you were without Part B. I know that sounds confusing. In 2024, the base Part B beneficiary premium is $174.70. So if you were to go an additional 12 months without signing up for Part B when you were eligible, you'd be responsible for an additional $17.40 on top of whatever it is that you are paying for your Part B. If you go for a period of 24 months, then it would be $34.80 on top of what you're paying, and so on and so forth. And remember, this is not a one-time penalty. It gets tacked onto your monthly premium forever. Now let's talk about Medigap. So original Medicare is truly comprehensive and for the most part low-cost coverage. However, as we have discussed, there are not only premiums but also deductibles and copays and coinsurance, and there is no out-of-pocket maximum. And that's where Medigap plans step in. Now with a Medigap plan, also known as a Medicare supplement plan, yes, you will pay an additional monthly premium. However, these out-of-pocket costs, such as your deductible and copays and coinsurance, will be largely taken care of. And some plans will actually cover them entirely. And at the very least, of course, they will impose that out-of-pocket maximum. So yes, you'll pay an additional amount on a monthly basis, but it's going to take care of most of your medical expenses. Now let's be honest, when you're younger, most of your medical expenses are going to be less expensive when we're talking about your Medicare coverage. However, as you get older and your medical needs become more extensive, or if perhaps you are diagnosed with a more serious medical illness, then you may find that all of a sudden these costs become rather exorbitant. At this point, you may think it's time to sign up for a Medicare supplement plan. However, at this point, you may find that not only will you likely be charged more for your Medicare supplement plan, you may be denied entirely. And that's because there is medical underwriting associated with Medigap plans. So if you are older or you have more extensive medical needs, it may be very difficult to find an inexpensive Medigap plan. This is why it's very important that you enroll in a Medigap plan when you are first eligible. This would be the 6-month window after you turn 65 and enroll in Part B. During this time, there actually isn't any medical underwriting, so you're pretty much guaranteed the best price and your pick of all of the available plans. Now, you may not need that Medigap plan yet, but your later self will thank you. Finally, let's talk about Medicare Advantage. Now, many people are lured in by Medicare Advantage's promises of additional benefits at no additional cost. And yes, it's true that many Medicare Advantage plans offer benefits such as dental, vision, hearing, prescription drug, and many more, and those are not offered by original Medicare alone. And yes, it's true that many Medicare Advantage plans offer these additional benefits at no additional charge. You simply need to continue to pay for your Part B. So it's very easy to see why these Medicare Advantage plans can be so very appealing. However, Medicare Advantage plans are managed care plans that operate within networks. And if you opt for an HMO, that means you can only go in-network. And many people report extreme difficulty finding doctors and hospitals who accept their plan and have to travel extensive distances. And even then, they have limited options. True, you can opt for a PPO, however, you'll still need to deal with the issue of pre-authorization. And that means that even if your doctor recommends that you receive a certain treatment or service, your insurance has to pre-approve it first. So that was the dark side of Medicare. Are there any parts that we missed? Let us know in the comments below. Of course, if you have questions, you can reach us not only in the comments, but at the number on the screen. And of course, there is no charge for our services. Remember, we are licensed nationwide, and we are more than happy to help. As always, thank you so much for watching and have a wonderful day. Bye-bye. Before you go, please make sure to like this video and subscribe as well to stay up to date. And if you want to learn more about Medicare, specifically about the differences between Medicare Advantage and Medigap, make sure to check out this video up here. We'll see you next time.